The flu claims more lives across the country, even here in Montana.
Children are dying and the sick are being hospitalized at an alarming rate. Some say this outbreak could top the 2009 swine flu.
Here in Montana, every single county has reported at least one case of the flu.
From the week of January 28th to February 3rd, 779 new cases were reported across the state. Now that brings Montana's total to 4,269 cases. 24 people have died, with a majority older than 65. No children have died in the state. The
spread actually has slowed here in Yellowstone County, with only 30 new cases reported, but it's running rampant up in Flathead County, where as many as 124 new cases have been reported.
This flu season now as bad as the swine flu pandemic that gripped the U.S. back in 2009.
CBS's Kenneth Craig tonight has more from New York, where a third child now has died from the flu, as has a teenager in California.
Students at Lorena High School tried to comfort one another after learning their classmate, Gabriella Chabot, died from the flu. She would have celebrated her 15th birthday next week. The Centers for Disease Control and Prevention says a total of 63 children have died so far this flu season. Doctors were hoping the country had turned a corner on the flu, but it appears there's no end in sight just yet.
We haven't seen the peak yet, and we don't know when that will occur. We're in week 11 of increased influenza activity. Some seasons can last as long as 20 weeks.
The CDC says hospitalization rates are up, and 1 out of every 13 visits to the doctor last week was for flu-like illnesses. That's the highest rate since the swine flu pandemic in 2009.
We're seeing an average of about 150 patients a day. We've been spiking up into the 170s. We've actually seen 184 the other day.
Among those patients, 16-year-old Lindsay Ruiz, whose mother and brother already had the flu.
They just got over it about 2 weeks ago, and then I started feeling symptoms around Tuesday. At school, I got dizzy and I got nauseous.
The CDC says the strains causing the most suffering are not new.
It's not uncommon for B strains to increase later in an influenza season.
Doctors are urging people, if you're sick, stay home, cover your cough and sneeze, and get your flu shot if you haven't already. Kenneth Craig, CBS News, New York.
And experts remind that while most people will get better and won't need antiviral medications like Tamiflu, there are others at increased risk for complications. If you happen to get those, get your doctor right away if you suspect you are sick.